Dietary tips in acid reflux treatment. When you think about acid reflux, what do you think of first? Which aspects of acid reflux are important, which are essential, and which ones can you take or leave? You be the judge. In cases of persistent heartburn, dietary improvements tends not to be enough alone. So as well as advocating a digestion-friendly diet, your doctor is likely to recommend one or more of the following types of medication. All about acid reflux. Acid reflux is scientifically known as gastro-esophageal reflux disease (GERD). It is a disease characterized by the abnormal reflux of gastric contents into the esophagus resulting to chronic symptoms or mucosal damage. Acid reflux is often caused by temporary or permanent alterations in the lining that separates the esophagus and the stomach. Ineffectiveness of the lower esophageal sphincter or a temporary relaxation connected with a hiatal hernia are just some of the common causes of acid reflux. The process can also lead to a backflow of gastric juices to the pharynx or mouth. Among adults, the most common symptom of acid reflux is heartburn, which is caused by the presence of acid in the esophagus. Heartburn is characterized by a painful burning sensation behind the sternum or breastbone. Another symptom or manifestation of acid reflux is esophagitis, which is characterized by an inflammation of the lining of the esophagus, which is also known as the mucosal lining. Esophagitis also causes swallowing difficulties and chronic pains in the chest area. Sometimes, individuals suffering from acid reflux may also experience coughing, persistent pain in the ears, hoarseness or a change in the voice, and even sinusitis. If acid reflux gets complicated, it may lead to formation of a stricture or ulcers in the esophagus. It may also lead to a condition called Barrett's esophagus and, in worst cases, to cancer of the esophagus. It doesn't mean, however, that a person who regularly suffers from heartburn is suffering from acid reflux. By all means, the heartburn may be from other causes. But if a person suffers from heartburn for more than once a week, then he or she is at a risk of acquiring acid reflux. Persons with hiatal hernia are also at a greater risk of developing acid reflux than those who are not. The pain felt by persons suffering from heartburn is caused by the reflux of acid contents from the stomach to the esophagus. A pain in the chest area coming upwards the mouth. Persons suffering from acid reflux may also experience tasting something sour or salty behind her throat. This is caused by regurgitation. This sour and salty taste may persist even without heartburn. Other less common symptoms of acid reflux include difficulty swallowing, chest pain, halitosis or bad breath, repeated throat clearing, and water brash or HYEPR secretion of saliva. The symptoms of acid reflux in children are also the same as that on adults. Acid reflux in children may manifest in frequent spitting, throwing up repeatedly, coughing, and other respiratory problems. Children suffering from acid reflux may also experience weight loss, frequent crying, loss of appetite, and bad breath. Parents must remember, though, that children may show one or many symptoms. There is not one symptom that is always present in children with acid reflux. The cause of acid reflux in children, especially in babies, is their immature digestive system. This is why infants stop having acid reflux when they reach the first year of age. However, some children do not outgrow acid reflux. Some continue to suffer from the disease up to the teen years. The best thing to do for parents of children suffering from acid reflux is to take the children to the doctor as soon as possible to avoid any complications. Antacids to neutralize the acid in your stomach, H2 blockers or proton pump inhibitors to reduce acid production, or prokinetics to strengthen the lower esophageal sphincter and expedite stomach emptying. However, if heartburn symptoms are mild and occur only from time to time, usually you will be advised to make the following changes to your diet. Obesity, especially excess fat on the chest and abdomen, is a common contributory factor to GERD and hiatal hernia, and therefore to heartburn. Choose a healthy calorie-controlled diet and customize it by following the eating tips below. Both these factors lead to an increased risk of heartburn. So opt for 4 to 6 small meals or snacks, and allow a maximum of 3 hours between eating. It seems like new information is discovered about something every day. And the topic of acid reflux is no exception. Keep reading to get more fresh news about acid reflux. In addition, choose foods that are easier on the stomach and more easily digested. Fizzy or carbonated soft drinks cause belching and upward pressure on the lower esophageal sphincter, increasing the likelihood of heartburn. The best drinks include water, herbal teas or diluted non-citrus fruit juices. Also note that some soft drinks, e.g., cocoa, coffee, orange juice, are not helpful for heartburn as they can over-relax the thus encouraging the backward flow of acid from the stomach. Constipation can lead to extra strain on abdominal muscles and increase the risk of heartburn. To prevent constipation, eat more high-fiber foods such as oats, apples, pears, dried apricots and vegetables. When increasing fiber intake, it's also important to increase your water intake by at least 40 fluid ounces a day, 4 to 6 cups daily. Alcohol is not helpful to heartburn for several reasons as it tends to irritate mucous membranes. Now you can understand why there's a growing interest in acid reflux. When people start looking for more information about acid reflux, you'll be in a position to meet their needs. Natural cures for acid reflux. Natural cures for acid reflux is an alternative for synthetic drugs. Gastro-esophageal reflux disease, also referred to as acid reflux, is a physiological condition that causes the regurgitation of the stomach content into the esophagus and throat. Acid reflux is very common and may occur due to inappropriate diet, stress and unhealthy lifestyle. Acid reflux can lead to serious complications like inflammation and scarring of the esophagus, throat problems and breathing problems. An effective way of correcting the activity of the stomach and of dealing with the condition is to keep a balanced diet and to use natural cures for acid reflux. There are many forms of medical treatments available for people who suffer from gastro-esophageal reflux disease, but the safest means of controlling the condition remain natural cures for acid reflux. Try to exclude caffeine, spices, fatty foods and citrus fruits from your diet and restrict the consumption of alcohol. Avoid smoking, as it can also aggravate the condition. Try to replace synthetic medications with natural cures for acid reflux and introduce healthy, carbohydrate-rich foods in your diet: rice, bread, pasta. One of the best natural cures for acid reflux is considered to be apple cider vinegar. In order to maximize its effects, it must be administered while eating. Mix 1 tablespoon of apple cider vinegar in a glass of water and drink it during your meal in order to achieve the best results. For the majority of people with the condition, apple cider vinegar is an effective natural cure that has a calming effect on the stomach and helps decrease the amount of digestive fluids it produces. Fresh apples, bananas and grapefruit peels are also effective natural cures for acid reflux. Dried figs, fresh pineapple and papaya are rich in enzymes which help in the process of digestion. They are good natural cures for acid reflux and a source of vitamins and minerals. Carrots and cabbage are also efficient natural cures for acid reflux and can control the secretion of gastric acid inside the stomach. Cinnamon is considered to be a powerful natural cure for acid reflux. It is renowned for its healing properties and its antiseptic effects. Cinnamon normalizes the activity of the stomach and controls the amount of gastric acid it produces. Cardamom, mace, nutmeg, and slippery elm can also make efficient cures for acid reflux. They have a calming effect on the stomach, control the secretion of gastric acid and can relieve soreness and pain. Take steps in improving your lifestyle, reduce stress and follow a good diet. Use natural cures for acid reflux and see which one works best for you. Try to gradually replace synthetic drugs with natural remedies, as they offer good results and are a lot safer to use.